Good afternoon, and welcome to our May 1st COVID-19 outbreak update from the Rath Building in downtown Buffalo. I'm Erie County Executive Mark Polenkars, and I'm joined by our Health Commissioner, Dr. Gail Burstein, as well as Karen Gambino from Deaf Access Services, who will be providing the American Sign Language for you today as we provide an update on what is happening with regards to the coronavirus outbreak, the COVID-19 illness in our community. We have some important things to go through today. I want to thank once again everyone for following the proper social distancing guidelines. It's helped us to flatten the curve, to smush it, as Dr. Burstein likes to say, so that we've kept our hospitalization numbers down so our hospitals aren't flooded. That's a good thing, and we'll talk a little bit more about that, but I do appreciate all the work that everyone's done to help us get to the point where we are today, where we're not flooded with hospitalizations or deaths, even though we still have hospitalizations and deaths. As usual, the proviso that the information that is provided is as current as it was when it was put into the PowerPoint presentation, and there may have been changes. And for the most accurate and latest to date information, please go to our special COVID-19 page, www.erie.gov/COVID-19. It is updated frequently with information for all different types of organizations, groups, individuals with the latest that we're aware of. So please go to that, and you can do that at any time from your phone or from home by just typing in that address. The cases, deaths, and hospitalizations as of May 1st today at 1 p.m., there were 3,481 total positive cases out of 17,009 that have been tested. These are the traditional nasal swab case tests we're talking about, the PCR tests. This does not include any antibody testing that may have been performed. 270 individuals who have died, unfortunately. That's 4 more since what we announced yesterday. And once again, I offer my deepest condolences to the family and friends of all who have perished. These are loved ones, not just a number on a screen, but mothers, fathers, sisters, brothers, children, grandparents, and we just offer our deepest condolences to each and every one of those who unfortunately has passed as a result of the contracting the coronavirus and the resultant COVID-19 illness. These were all lab-confirmed cases while they were alive. These are not presumed positive cases. We're not including presumed positives in the number that we are describing with regards to how many have deceased in Erie County. And we just want people to understand that. People are saying that we're trying to increase the figures of deaths for whatever reason, which is not something I ever want to see increased. So these are these are not presumed positive. These are actually confirmed cases. And then the hospitalization report for April 29th. As I've said before, we get the report at the end of a day, and it's for the day before. There were 253 individuals were hospitalized that were COVID-19 positive in all hospitals in Erie County. 107 of them were in the ICU unit, and 76 of those required an airway assist. And as you can see from the chart that'll pop up on the screen, this is the all hospitalizations dating back to March 27th. And you can see we're still at a higher point with regards to all hospitalizations, though ICU data has stabilized and intubations have reduced. We've had 253 hospitalizations for the last 2 days after the highest day ever recorded on April 7th, which was 258. As I said, ICU patients have stayed fairly constant for the last 5 days or so, and intubations have decreased over the last 2 weeks. Here is the chart looking back at a 2-week period, which is very informative because it's a key indicator with regards to where we are and how we can open up. So you can see we've seen a slight increase recently with regards to overall hospitalizations, while ICUs and intubations have stayed fairly constant. Dr. Burstein, would you like to talk a little bit more about what this means?
It means that we have to continue with our social distancing and wearing masks and hand washing. Again, everything that we do today is going to affect the numbers on that graph in 2 weeks' time. And so remember, we have to, if we want to reopen, if we're working through the governor's plan, we really need to get these numbers down. We really need to start to see some type of trend downward. in hospitalizations in order to open up. So it means it's really important that what we do now will get these numbers down hopefully in the next couple weeks. So that's very important. Again, looking at our total hospital capacity, even though our numbers have upticked recently, we still are well within our hospital capacity, both in the general beds and in the ICU and with ventilators. And then also just want to emphasize that the hospitals are a safe place to go. So if you are sick with a COVID-19 related illness and you're very ill, or you have something else like chest pain or bad belly pain, or it's time to deliver a baby, the hospitals are safe places. They're doing an excellent job with infection control, and they know what they're doing. And for people who walk in COVID negative, they should expect to walk out COVID negative.
Dr. Burstein, I just want to ask you a question. You talked about 2 weeks. The hospitalization data is generally sort of a lagging indicator of when the individual contracted the coronavirus. So when you talk about 2 weeks, the information that we see on the screen here, this last 2 weeks of data, these are when people were in the hospital, but they probably had contracted the coronavirus up to 2 weeks before. Isn't that correct?
That is exactly accurate. So we know that the incubation period for coronavirus onset of symptoms can be anywhere between 2 to 14 days. Usually shoot in the middle at about a week's time, and then unfortunately, people usually can start out with mild symptoms and then progress to severe illness. So we're thinking about usually about 2 weeks between the time, 2 to 3 weeks between the time a person is infected and they would end up in the hospital with severe illness. So again, it's what we all do now counts, every single person.
Thank you. Now, we talked about 253 people being in the hospital as of April 29th. This chart and numbers indicates the age range of the individuals who are in the hospital. And as you can see, the majority is over the age of 55, but there are individuals who are younger. We've had a lot of questions and comments to our office saying, why don't you release more specifics about the individuals who are in hospital? Are they coming from nursing homes? Are they coming from elsewhere? And the answer is we do not receive that information. We receive just a general number in the age range, and you're looking at the charts, and these are actually taken directly from the report that New York State provides us. So we do not know where the individuals are coming from. All we know is the breakdown based on age, and you can see that the vast majority of those are over the age of 55, but when people are saying you need to provide more information, are they coming from hospitals or not, we do not receive that because we do not regulate the hospitals. New York State does. So they control access to the data. And this data just proves that the age ranges, but we do not know where these individuals came from. So those that are calling and saying you need to provide more data about who's hospitalized, we do not get that data. And even if we did get it and did receive the individualized data, it is protected by HIPAA. It is not something that could be publicly revealed. But I did want to show this chart and also explain to those that are clamoring for more information as to who's hospitalized and why aren't we releasing it. It's because we do not get that data. Hospital admissions, we've talked about this being a very important key indicator with regards to whether we're going to reopen or not. This is hospital admissions for the last 2 weeks. In the most recent day, which is April 29th data, there were 26 admissions plus conversions while in hospital, 22 discharges, so there were 4 more people. That's what that blue bar is versus the red bar at the end. But we also wanted to sort of give you an idea of what's happening on a 2-week basis and a 1-week basis. During the last week, there have been 191 admissions. That exceeds the discharges of 173. And there have been, over a 2-week basis, 390 admissions versus 332 discharges. So we still are seeing, and this is why we're continuing to see a little growth in our hospitals. The discharges do not include as a discharge those who've deceased. That's a separate number. We sort of take that out when we look at the comparison of admissions versus discharges. But this is concerning because we know that we want to reopen the area, and to reopen it, we have to keep our hospitalization numbers down. And if the hospitalization admissions continue to exceed discharges, it's going to be tough to do that. While we are not at capacity for our hospitals as well as our ICU. Until we continue to see that number go down with regards to admissions, especially over a 2-week period, it's going to be tough for us to reopen in the near future based on the guidelines that New York State has put forth. Doctor, would you like to add anything with regards to that?
Oh, thanks. Our county executive is exactly right. We really want to get to a place, hopefully this summer, where we'll at least be able to enjoy going to, getting to some businesses open. And so, again, everything that we do now is going to count on those graphs. So every single person is responsible for those numbers, for that curve. So we all have to work together to keep our social distancing, continue masking. I mean, we know that there are so many factors that affect transmission in our community that would lead to people being hospitalized. So we know that these social distancing, masking, washing our hands, we know that they're effective because we've seen our hospital numbers go down in the past. So we have to, step back up, keep up those behaviors and get those hospitalization numbers down again.
Thank you, Doctor. As you said, this is a key indicator. New York pause is still into effect until May 15th. The governor announced he would make an announcement beforehand. This is the data that New York State's looking at. It's the data that we're looking at. So it's very important over the next period of time that we see that red bar exceed the blue bar on a daily basis. If the blue bar keeps on exceeding the red bar, it's going to be tough for us to see declinations in our hospital data.
That would be the wrong direction.
Yes. Mortality data, we think it's very important for the public to see this. This is as of May 1st. We've had 5 individuals in the 30 to 39 age group that have passed, 7 in the 40 to 49, 13 50 to 59, and then of course you see the much bigger numbers between 60 to 69 and above. We just believe it's important for the public to understand who unfortunately is passing. Males are passing at a greater rate than females, approximately 51% to females 49%, which is kind of flipped from what the population data is for Erie County, where there's more females than males. And in general, more females are contracting the coronavirus than males by almost the same ratio as you see there on the screen. But we do know because of age issues, comorbidity issues, that males are passing at a higher rate than females. This is the same sort of information, but on a bar chart, so it's a little easier to see the blue and the females with regards to fatalities by age group. And then let's go on to the next chart, mortality, date, race, and ethnicity. This shows the percentage of the population based on the most recent census data from the American Census forms that date back just only a couple of years, not the full census from 2010, versus the percentage of fatalities. When we were first starting to take a look at this data, we saw that African Americans, people of color, were making a much higher percentage of overall deaths, people who died, unfortunately. That has dropped down to 20%, about 20.5% right now. It was over 30% at one point. Whites are equaling out more based on what their population ratio is. And those that are identified as Hispanic or Latino are still a much smaller portion of the fatalities than they actually make up of population. This information is very good with regards to taking an idea of where there may be breakouts and additional problems that we have to deal with due to health disparities in our community. We'll continue to keep watching this. We think it's important data, and it gives us information that we need to know with regards to how we need to respond going forward. And we do respond. The Erie County response has been very, very big, and there's a lot that's going on, including, of course, testing. So I'll turn it over to Dr. Burstein to talk about testing criteria once again and a number of the things that are going on in our community.
Sure, and thank you. So we really want to make sure that we identify every single person that could have a positive COVID-19 test, so we can isolate them, remove them from the community, stop the chain of transmission, and start bringing our numbers down. So who we really want to test is any person that has any type of symptoms that can be consistent with COVID-19, regardless of where you work or where you live in Erie County. We really want to test you. The sample collection is by appointment only, so people can call 858-2929, and then there's an option, a menu for various options. So option 1 is for general questions from the public, not necessarily for testing, but just general COVID-19 questions. Option 2 is for people who are ill with COVID-19 symptoms that have a primary care provider. They'll be referred to Kaleida. They'll get linked in exactly by pressing that button. Option 3 is for people who are ill with COVID-19 symptoms who do not have a primary care provider, and the county will test you. And then option 4 is for healthcare providers that do have any questions. And also, I would just want to add that we are also being very aggressive about offering testing to any contacts of people with a known COVID-19, because those individuals are also at very high risk. So our contact tracers, when we're calling them, the contacts and speaking to them, we're strongly encouraging them to get tested so that they can know their status and take the appropriate action. And so we are so fortunate working with our Kaleida partners that they have opened up a new testing site in the city at the Leroy R. Coles Jr. Library on East Delavan Avenue. And so that is open now as expanded hours on Monday, Wednesdays, and Friday between 9 a.m. and 5 p.m. And those are for any individual that has COVID-19 symptoms, just like our county clinic. And again, it's by appointment only. And we really want to encourage people, if they have a primary care provider, work with your primary care provider to get that prescription. Remember, if you're sick, you should be talking to your primary care provider. For those that don't have a primary care provider, we still encourage you to get testing, and there'll be information at the, actually when you call or when you go in to get your specimen collected, about where some great primary care providers you can get linked up with in our community.
And I just want to note, we don't have a screen for it, but New York State has opened up a drive-through testing site in downtown Buffalo. We just got information from the New York State Department of Health on that, so we don't have a PowerPoint screen to show you. But New York State is also doing a drive-through testing for first responders, healthcare workers, and the like. And once we get more information, we will provide that as well. One of the things that we've been working with is hotels for frontline medical workers who are afraid of going home and potentially exposing their families. So there's a number of hotels that are available to give them an opportunity to rest, relax, or stay for the night. The Millennium Hotel near the Weldon Galleria is offering for nurses, doctors, and other medical personnel. They can clean up, take a shower, change, decompress before they go home. The Wyndham Garden in Buffalo, downtown Buffalo, is offering a special first responder rate for $70 a night if first responders want to go there. We also have Home Suites by Hilton, as well as Hampton Inn by Hilton, and one in Amherst, one in East Aurora, and they're offering free rooms to frontline medical workers to sleep, recharge, and isolate from their families. You should call the number on the screen, which is 716-403-0100, or email at the address you see on the screen. If you are a frontline medical worker and you would like to take advantage of this, that's offered by two Vision hotels, the Home Suites by Hilton in Amherst, as well as the Hampton Inn by Hilton in East Aurora. And we thank these hotels, for helping our frontline medical workers address the concern that does exist about them potentially being exposed to COVID-19, having to worry about taking it home to their families, and also giving them an opportunity to decompress and relax before they go home. So thank you to those hotels for doing that. We know that this is trying on so many folks, and that's why there's a number of support lines, and I'll turn this one over to Dr. Burstein to talk about the impact that physicians have had and how there is a physician support line.
Thank you. Yeah, so speaking with my colleagues, I know that it can be so stressful taking care of these very ill people, and really long days in the ICU, and seeing people suffer losses. And so physicians are people too, and we need support too for very stressful working circumstances and even home circumstances. So there is a free physician support line. It's actually staffed by volunteer psychiatrists for our physician colleagues that are taking care of COVID-19 patients. This is free and confidential. So people can either call the phone number on the screen, 888-409-0141, and speak to somebody live. It's open 7 days a week from 8 a.m. Till 12 a.m. Eastern Standard Time. And there's also a website, www.physiciansupportline.com that people can, if they, if that's how they prefer to communicate, that's also a mechanism. So just want to encourage people to reach out, and if you feel like you need help, you need help. It's okay.
And then,
And oh,
I was just saying, then we have a number of lines that are based for support for all, because we know this is mentally trying for so many individuals. There is, of course, the 24-hour crisis hotline for adults based in Buffalo and Erie County through Crisis Services. So if you are in a serious situation, you are in crisis, you can call at any time of the day to 834-3131. You will talk to a trained individual right here in our community, in the city of Buffalo. You're not going to be switched to a call center somewhere else. So if you're in a crisis situation, you don't know which way to turn, you think there's no hope, there is hope. There are places that you can turn to. And the first thing you should do is call the Crisis Service Hotline at 834-3131. And then, of course, we have the 24-hour addiction hotline at 831-7007. Unfortunately, we have seen an increase in overdose cases, and this is less cases associated, which is straight would normally be considered opiates like heroin and fentanyl. And I'll turn it over to the doctor, because we have seen an increase in individuals who are overdosing and dying due to what appears to be cocaine ingestion. That is also includes fentanyl. So, doctor, would you like to talk a little bit more about that?
yeah, thank you. The circumstances are really frustrating. We're seeing more and more deaths that are related to cocaine, and we think that many of those are spiked with fentanyl. But even just cocaine alone is very, very dangerous. And then you're buying it on the streets. You don't really know what it's spiked with, and so we're our scene investigators are reporting seeing many more scenes, death scenes where there's evidence of people snorting white powder, probably thinking that it's cocaine, and it's laced with fentanyl. Also, people are using alone, and then so even if they had Narcan with them, that's something that they wouldn't have the opportunity to be used if if they overdose and pass out. So please, if you're going to use something, make sure that there's somebody around, a friend, to be there with you. Also, at if you're going to use something, maybe just try if you really need to use, just try a small amount, and see how that affects you. But again, please be careful. And these are folks that are not the same folks that we, unfortunately, the victims that we saw last year, people in their 20s and 30s. These are people, unfortunately, like my age, people in their 40s, 50s, and 60s. So please, nobody is immune. Everybody is at risk that is using, and so we just have to stay safe. We have to survive this together. So please, if you have to use with a friend or a witness, or be there. Somebody knows what you're doing, and then also have Narcan on site, regardless of what you think that you're using.
Thank you, doctor. It is a concern, and we're keeping track of that. And our opiate task force is working very hard to provide Narcan where it's needed. I want to thank all our partners that have worked with us to do that. But it is disconcerting to see the number of increases in deaths, especially among those who think they're just using regular old cocaine, and they're probably not, and dying alone. It's very sad. Spectrum Health and Human Services offers a special helpline for families and children in crisis. You can call 882-4357 anywhere in the 716 area code. And then, of course, there is a COVID-19 emotional support helpline through all of New York State. It's open from 8 a.m. to 10 p.m. daily, 7 days a week. And that's 1-844-863-9314. So please, if you are in a crisis situation, please call Crisis Services at 834-3131 in the 716 area code. If you just need emotional support on COVID-19, there are lots of resources out there. We recommend you call these emotional support number on the screen, 1-844-863-9314. And if you are in a situation where you have an addiction and you need help, we offer a 24-hour hotline for that. And we have a team that's ready to help you. That's why I ask you to call 831-7007 to talk to a trained professional today. Campgrounds. We're going to finish with this before we open up to the general public. The current Erie County emergency order regarding campgrounds has been extended. However, The order has been amended and submitted for approval to the New York State Department of Health, that if approved, it will rescind the current order and allow for some self-contained recreational vehicles on seasonal campsites to be allowed in with certain restrictions. So if somebody has a tent camp and they need to use the bathrooms that are provided, because we cannot guarantee the safety of those bathrooms, those would still be prohibited. But if you have a recreational vehicle, if there's a permanent building that has a bathroom associated, those would be allowed at campsites across Erie County. So we are waiting for approval from New York State. We are expecting to receive it, though we will officially announce it when we receive it. But once it's received, then recreational vehicles that have their own bathroom facilities included therein, as well as any permanent buildings that may have a bathroom associated, would be allowed. Those that do not, those like just a tent camping area, those or a building that does not have a bathroom that can be cleaned, self-cleaned, those would still be prohibited under the new order. And as soon as we get information from New York State as its approval, we'll let the public know. We are anticipating getting approval, if not through today, at least early next week on Monday.
Oh, and if I may add, if we are able to offer like a limited opening of the campgrounds, it's many of the facilities or that people traditionally enjoy in the campgrounds are not going to be available. Again, we're under the New York pause, so the beaches will be closed, the pools will be closed. There won't be any big group gathering bonfires. So remember, it's not going to be the same for those who are able to get in if New York State allows a limited number of people into their seasonal campsites. Remember, it's all under New York pause, even in the campgrounds.
Thank you, Doctor. One other thing before we take questions and answers from the media. As you probably all know by now, Governor Andrew Cuomo has officially ordered all schools to be closed through the remainder of the school calendar year, which would normally be through June. He has not made a decision yet with regards to summer schools. My office was in consultation. We offered recommendations with regards to what we thought was appropriate for Erie County. Decision was made based on the safety of the children, as well as the potential of spreading the disease through children to their parents and grandparents, and that decision was made statewide. That is in effect and will be in effect. So for the parents that we're hoping that they could potentially have their children go back for at least the end of the school year, the late May or early June part, that is not going to be the case. We will be discussing this with the school districts and the superintendents of the school districts to get further advice from them as to how they need to continue the distance learning. That is something that has worked to a degree. I know it's not easy to distance learn depending on the age. High school students, middle age students, or middle grades are a little bit easier. Younger ones, not so easy to do distance learning. So we're going to continue to have those conversations with superintendents. But we now know that regardless of what happens with the New York pause order, which is still in effect until May 15th, all schools in Erie County, in Western New York, and in New York State will be closed for the remainder of this school year, whether it's a public or private school. And that was a decision that was made by the governor in consultation with the State Education Department, the New York State Department of Health, as well as recommendations that were made on the local level. So I know a lot of people are not 100% happy with that decision, but it was a decision that was made for the best interest of the health and welfare of the students, as well as their families, with regards to the fear that even if a student was caught it from another student and did not suffer any serious illness, they could transmit it to a loved one who would. With that, we'll open it up to questions from the media, and let me just grab my handy-dandy little sheet here, and we will start from the bottom today, and we will start with a WKBW-TV, Ed Dranch. Ed, haven't heard from you during the crisis. Welcome.
County Executive, thanks for your time today. I appreciate it. I just want to touch, I have a couple of questions, and I just want to touch briefly on both of these right now based on what you just said about schools. You were consulted or provided some sort of recommendation to New York State based on what we're seeing on the local level, so I'm wondering what your recommendation was, seeing as you thought perhaps there could be school toward the end of May and June. And then for the doctor, as a pediatrician, I'm wondering advice for parents who might now be struggling with, how do I talk to my children about this?
Thanks, Ed. Well, with regards to recommendation, it was always based on, can you safely reopen the schools? Is there a way to do it? Would you require students to wear masks? Would they have gym class or not? And if they felt that it could be safely done, then I was under the impression that we could theoretically open for at least a couple weeks to give the students an opportunity to return, to gather the things, to finish up, and have the traditional moving on ceremony, commencement, if not having a graduation ceremony, at least knowing that the students can move on. But I think it came down to a situation of, can you safely ensure that if the students go back to school, they're not going to transmit the illness to family members or themselves catch it and potentially be sick. And New York State made a decision, felt that at this point they couldn't safely do it. I understand the decision. You have to err on the side of caution. And I know a lot of parents were hoping that their children would be back, but the decision was made by the state, and as such, we will support it to ensure that we are protecting the safety of all children in this community as well as their families. Doctor, the other part?
Sure. So your question is, how do parents communicate to their children around the continued closure of the schools for the rest of the school year?
Yeah, absolutely. And obviously, parents are under an immense pressure right now to make sure that their kids are occupied, entertained, learning at the same time. They're facing their own troubles potentially, and now they've also added teacher to their list of duties. So how do you communicate that to your child, number one, and number two, how do you manage that pressure?
So that is a challenge, and as a parent, I can completely respect what a huge challenge that is to educate your own kids. Especially with the dynamics of parents, children are a little bit different than the dynamics of a teacher child. So the teacher student, so it makes it a little bit more challenging. So what my recommendation is, again, basic tenets. Talk to your kids. Keep those lines of communication open. Let them know that the classrooms are going to be closed for the rest of the year, and the teachers still really care about them, and they still want to make sure that they're educated. And as parents, you're going to work with them and help them get educated through an online, and make sure that you talk to them about it. Ask them, how does this make you feel? And you can let them know how it makes you feel, and again, answer any questions. I think basically what's important is that the lines of communication are open, and if they feel stressed and or they're struggling with something, that they can feel comfortable talking to the parent. I think that's that's the best option for to a road to success. And then for parents, I can understand that is that's a lot of pressure. And my kids are home from college, and even though we they like visiting home, they're excited to be independent adults and away from home. So that I understand that's disappointing too, and just that pressures that puts on the family dynamic. So again, talking to your kids, and talking to your partner. Helping to work together, and trying to make sure you take good breaks, and again, figuring out that balance. I always feel, especially for working parents, it's tough to juggle a career and a family at the same time. So any support you can get, but talking, and then thinking about fun things to do. Reaching out to other friends and families remotely is another option. But we have to be creative, and I acknowledge it's really, really tough.
And I would just note that the decision that was made was a statewide decision. I know that talking to my colleagues across New York State, yesterday I talked to Laura Curran, the county executive of Nassau County, where they've had a tremendous problem. She was under the impression that it would be very difficult to open the schools back down there. We're different here in Western New York, but I also understand the decision. I respect it, and I support it from a standpoint of, we need to protect our children and our families. And I think we know what happens when kids get together. They share germs like crazy, and often it's the children who get sick initially, and then the parents who get really sick. So I fully understand the decision, and we will work the best possible to ensure that the students who need to graduate and move on will graduate and move on with our local school districts, and try to make it as normal as possible going forward. Mel Orleans from WIVB-TV.
Hi, County Executive. Thanks for taking our questions this afternoon. My question also about schools, and I actually spoke with a principal last night who's concerned about, now that distance learning is a reality, concerned about getting the students the technology that they need to learn if they're in a household where they don't have that, and then the funding for the technology, should we have to continue this over the summer and then into the fall. And I was curious how the county is working with superintendents to discuss potential need for funding in that aspect.
Well, we've had a number of conversations with superintendents. We have not had a conversation with regards to funding of the need for laptops and what would also be high-speed internet for many of the children and their families in our region. We know that there are still households in our region, quite a few of them, that do not have internet access, do not have a laptop at home. They would rely normally on libraries for their computer needs, but the libraries are closed. So it is a concern, and it's something we'll have to have those conversations going forward. I hope, I really do hope that this is the end of it, where we're talking about that this closure is through the remainder of this calendar year, but when they pick it back up in September, we're like we normally would, that children will be able to report back, but you got to prepare for the worst, hope for the best. So there's the discussions we'll have going forward. But I can tell you, we have not had a discussion yet with school superintendents with regards to that issue and the cost associated with it.
Okay, thank you.
You're welcome. WGRZ Channel 2, is anybody on?
Yes, Steve Brown is on. Thank you for the opportunity. A couple of things. You've had very broad expansion of testing. We saw the downtown drive-through testing site open up. We saw one in CCC. Obviously, testing has become much more robust in Western New York. I want to point out that the percentage of deaths amongst nursing home residents in the 8 counties of Western New York is roughly 37% of all COVID-related deaths. Statewide, that figure is closer to 20. So we're almost double that. Is there any idea that either of you have that would account for that disparity?
We certainly have been watching and monitoring and working with the New York State Department of Health, which has been sending the individuals in to actually do testing. I know we've assisted New York State Department of Health as well as nursing homes by getting their residents as well as staff tested. It's something that is a constant concern, and I can tell you that we spend a lot of time dealing with that issue. If we receive reports that show that there's an outbreak at a home, we immediately work with New York State Department of Health to address that. I'll turn it over to Dr. Burstein to talk a little bit more, but it is a big concern. We are very worried. And remember, nursing homes have been closed to the general public for basically 2 months now. And we know if the COVID-19 illness is getting in through the nursing home, it's probably coming in through a staff member who appears to be healthy, asymptomatic. And so we are very much concerned about that, and that's why we've had conversations with New York State, but I'll turn it over to Dr. Burstein to talk a little bit more about it.
Thank you. So we are assisting New York State Health Department with their investigations of the COVID-19 related cases in the nursing homes. We know that they have, they're going into the nursing homes, working with the staff, making sure those individuals are tested, the staff, and then also making sure that the residents are also tested, and that all the staff have the appropriate personal protective equipment, and that the residents that are COVID-19 positive are isolated. Also, our nursing homes have actually been working together as a community and trying to designate specific nursing homes and long-term care facilities for COVID positive patients, and so they would really be isolated into one facility, whereas other facilities would they would try to keep free of COVID-19. So that's one of the reasons why you might see that some nursing homes or long-term care facilities have an abundance of COVID-19, is because many times people were intentionally placed in those nursing homes or long-term care facilities if they have COVID-19 to help protect the other residents in the area where they were coming from. Also, every nursing home death circumstance is different. I mean, we have been following those deaths, again, trying to figure out what was what was the cause, and how this was, if this was really nursing home related or not. We've seen a number of, unfortunately, COVID related deaths among our seniors, where those individuals were home. They became ill with COVID-19. They were admitted to the hospital, and then they were transferred to a subacute care facility, or a nursing home, or a long-term facility, to after they were not ill enough to require a long-term bed, or if they had or acute care bed, or if they had a DNR. Again, they didn't want to occupy a hospital high intensity bed, and so were transferred to a nursing home, where unfortunately they would pass away. So not every death in a nursing home is because they were infected in a nursing home. So every circumstance is different, and we are also following that.
And it is a concern to the point that I've asked our Department of Health epidemiologists, when they get data back showing the cases that are coming in, to self-identify as best as we can. Are they nursing home residents? Are they assisted living home residents? Are they residents of a senior apartment complex? So that if it appears that there appear like 3 or 4 new cases come in and it's a senior apartment complex, we want to know about that so we can address it and work with the New York State Department of Health on that. And we have done that internally, and our Department of Health staff is working with New York State to address this concern. And as we said, it often is a patient who may be brought in there who was COVID-19 positive, or as sometimes is the case, it's an employee who's asymptomatic, and then the goal is to not only test the patients but the employees, because we certainly don't want employees in there, even though they may be healthy as can be otherwise, and then passing it on to the patients. So it is a concern. We are working with the New York State Department of Health. The New York State Department of Health regulates nursing homes, so they're the ones that are sending staff in there to do most of the work. But I'm concerned about it to the point that we've done additional analysis internally to try to figure out and stem the tide of an outbreak if it should occur.
Wouldn't the appropriate response in this situation that we find ourselves is to have regular staff testing of all nursing homes?
That is a discussion that's going on with New York State at this point. We're talking about thousands of residents in Erie County as well as staff members. So we would have to have adequate supply, and that's why we believe it is something that the New York State Department of Health is considering. So just I'll let you know that those conversations have occurred.
Thank you.
You're welcome. WBLK, is anyone on? If not, is anybody on from WBFO? WBEN, Mike Baggerman.
Hi, Mark. As we talk about reopening of the Western New York region, I know that one of the factors that goes into it is that there has to be 2 weeks of a downward trend of hospitalizations. And let's say, we see 10 straight days of that downward trend. But if there's one day where there's a net increase, even if it's just by one, from one day to the next, does that mean that the county would have to start over on that 2-week trend?
No. What we've been informed is we got to look at it over the 2-week period. It's just not one day. But if you have a big jump, if you have one case, if you started the 2-week period, let's say you were at where we are today, 253 cases, and you ended the 2-week period at let's say 230 cases. If we had one day in which it jumped up a couple cases but still went down over the 2-week period, I think we'd be fine based on the conversations we had. Our problem is the recent period, we've had some of the highest cases we've ever reported. So we need to continue going down. If we stay plateaued where we are, or we, as we did in the last few days, actually went up from where we were, it's highly doubtful that we would see a reopening. Now, there are other indicators that have to be looked at, and some of those we already have in place, such as the hospitalization, or the hospitals themselves have bed capacity. We have separate isolation facilities available for those who cannot isolate. We are doing contact tracing. A lot of people think we're not doing contact tracing. We are doing contact tracing with individuals who test positive, especially with their close contacts at home or work. But the hospitalization number is a key factor as identified by New York State. So we will continue to watch it. But I don't think a one-day blip out of a 2-week period would hurt us. We need to see that decline consistently over the 2-week period one or two new cases is not going to kill us, but if we keep on going upwards as we have recently, then we're in trouble.
Did I hear you mention earlier that the hospitals in Erie County are at capacity?
No, we are not at capacity. I don't think that was said. Last I checked from earlier today on the 29th, I think they had over 40% bed availability in both the traditional just total beds and ICU beds. Remember, the number that's listed is 30% after elective surgeries. We haven't even been allowed to have elective surgeries yet. But let's assume we had limited elective surgeries. I think we still would be at that or better than the 30% threshold. Last I saw, I think we're right around 42% of beds available, both in the traditional overall beds as well as ICU beds. But we are not at capacity.
Thank you.
You're welcome. Spectrum Buffalo. Anybody on from Spectrum? Investigative Post? Buffalo News. Aaron Besker and Sandra Tan.
Hi, Mark. There are some area towns that are already making decisions regarding furloughs and layoffs. I know that you were waiting to hear about additional stimulus money, but I also know that Erie County is doing some work regarding reviewing and adjusting its own seniority list for staff. If furloughs or layoffs were necessary, do you know which departments would be most effective and where you would have to start in terms of cutting employees?
All departments would be affected. All offices would be affected. I had a conversation with the other independently elected officials as well as the legislature and the Board of Elections, in which we told them that we are seeking a proposal from each department office to provide us a 13.1% cut across the board. We've asked for them to provide us that by May 15th, I believe is the date, 2 weeks basically from today. It is a concern. We are looking at a $200 million plus shortfall just on sales tax alone. We will be getting updated sales tax data on May 5th, which is sales tax data for April, or at least the early part of April. We are expecting it to be very bad. We know hotel tax is going to basically be non-existent. Mortgage recording tax has dropped tremendously. So we've lost almost every major revenue line. I've had conversations with not only Congressman Higgins, but in the past Senator Schumer and his staff, as well as others with regards to the federal assistance. I'm hopeful that they pass a federal assistance program, but even if they do, that will not cover anywhere, probably won't cover half of the lost revenue that we're projecting. Because we think under the latest numbers from Senator Schumer's office, we get about $83 million in the next round of stimulus funding. Well, I think everyone knows 83 is not 200 million plus. So I am very concerned that even if we get the stimulus funding, we will still not have enough. The 13.1% cut across the board is a worst case scenario. I'm hoping that we won't have to do that. As part of the budget balancing amendments for 2019, we've pretty much cleared out almost all of the rollovers that we would have done. This is something Sandy will understand. The average public's like, what's going on? But we want to create a special fund to cover shortfalls. And right now that's about 20 million plus in the budget balancing amendments that would have been put forth towards projects that we had planned to do, but we're not going to do this year. But every department, every office would be expected to contribute. It's not one that's going to receive more than the others, and it would be a 13.1% cut across the board. And I'm hopeful that my partners in government understand the severity of this crisis, and as such will come up with a plan that makes sense to provide the services that we need to, but doesn't shut down entire departments. And everyone understands that this is a crisis situation unlike any other. The red-green fiscal crisis was a problem because county government couldn't control its spending. It didn't have a revenue problem, it had a spending problem. This is a revenue problem, and it's not just our problem. Every government across the country is dealing with this. And that's why I do support the passage of a stimulus package number 4 to assist local governments and states with their needs. And if we do get that, then we would not need to do a 13.1% cut across the board, but we'd still need to do a cut. I just don't know at what total that would be at this point.
Aren't there, though, some departments that get more state and federal reimbursement than others? I mean, would there be sort of disproportionate impact on departments?
It depends. There are some that do. The state has come back and said you should expect a 20% cut across the board, so you need to cut those programs by 20%. But what you'd have to do is spread it out more. We've had conversations with various department heads, commissioners about this. I don't like this at all. It's not like I want to do this, but I also have to be able to ensure we have a balanced budget. And I'm not like the federal government, or I should say Erie County's not like the federal government. We can't just print more money. We have to balance our budget. And it's just how it's going to be in this situation. And we believe that this will carry over to some degree for 2021. It's just not going to be good. I'm not happy about it. Nobody's happy about it. But we also have to ensure that I'm not going to go back to the public at a time of crisis next year and say, well, you know what, we're going to raise your property taxes to make up for the shortfall. That's just not going to happen. So I have to do the alternatives. Aaron, are you there?
Okay, thank you.
I don't know if Aaron's still there.
Yeah, hi, Mark. On Wednesday, you mentioned that I believe some people had been with treatable diseases in the county had died, though they had not sought hospitalization or medical treatment. I'm wondering if you could shed a little more light on the scope of that and what led you to address that concern.
We've received reports of individuals who've been found deceased, especially at home, of conditions that we believe could have been treated if they went to hospital. We've had reports of individuals saying they don't want to go to hospital. I've asked for more information from the medical examiner's office, but they do not have every record of death. We really get that from New York State afterwards. So I'll turn it over to Dr. Burstein to talk a little bit more about it. We're concerned about that. That's why I included it in my presentation on Wednesday, and Dr. Burstein talked about it today. If you're suffering from a health condition and you're worried about going to a hospital because of COVID-19, please don't. Go to the hospitals. They can handle it with a capacity-wise, and they have separate wards and divisions to split those that are COVID-19 patients from those that are not. Dr. Burstein?
Sure. So our Erie County medical examiners investigates all suspicious causes of death. And so that would be suicides, homicides, accidents, drug overdoses, natural causes of death, which would include causes from infectious diseases like COVID-19, and then include causes from heart conditions or chronic lung disease or diabetes or any other medical condition. That's classified as a natural cause of death, and the physician that is taking care of that person signs off on the death certificate. Sometimes we receive those reports. Sometimes some physicians and some hospitals notify us of those deaths. So it's not a consistent source of information. However, our medical examiner's office has reported to me that they've receiving more this year than they have in the past. So we are looking at that. We're looking at all the different types of information that we get around deaths in Erie County and trying to come up with some conclusion. Again, the natural causes of death, say from heart attacks or stroke or from chronic lung disease or cancer, we don't regularly get those reports, so we have to try to piecemeal it together. The New York State Department of Health keeps those data in their vital statistics. They are, the availability of those data, current data, is usually, not those data are usually not available to outside of New York State Health Department. So what we have access to, the most current data from vital statistics in New York State, is 2017. So again, talking to our partners in the hospital, that they're not seeing the caseloads of people with suffering from heart attacks and strokes and lung disease exacerbations like asthma or cancer. Or belly pain that could be corrected with a hospitalization. They're seeing a lot lower numbers of that, and so we're putting together that we're seeing more natural causes of death, at home or at late presentation to the hospital where it's really too late to offer effective treatment. Versus the low numbers of admissions and emergency department visits in the hospital. We assume that people are afraid to go to the hospital for COVID-19. So again, hospitals are safe places. Don't be afraid to go if you have to go to the hospital.
When you say the more this year than they have in the past, do you have any idea by what scale or how much?
We're looking into that now.
Okay.
When it comes to the overdoses, we remember it takes some time to actually get the laboratory reports back to confirm what the substance was that actually killed the individual. We just can look at the anecdotal evidence with regards to late March and April and see that there appears to be an uptick compared to the prior 2 years, in which, of course, we've done a very good job of reducing the deaths in our community. We've been doing it for mostly an hour, so the last question will go to Ethan Powers of the B News. Ethan?
Hey, Mark. Thanks so much for taking our call. Just wanted to get your perspective on the relative uptick we've seen in relation to hospitalization data. The county said for weeks now that we wouldn't see our peak until around mid-May, but earlier this week you showed some disappointment that our hospitalization numbers were rising. Is it possible that the rise could be due to the expected progression of the virus trajectory, or do we have evidence at this point that the recent uptick is due explicitly to residents not adhering to those social distancing guidelines?
Well, it's tough to say exactly what it is. The original projections that had us reaching our peak in mid-May were based on less social distancing than we've been practicing, so that we would have seen a much higher peak in mid-May. And what we've been seeing is thankfully a smoothening, a flattening, or as the doctor likes to say, smushing of the curve. And as a result, it's going to just push everything out further. We expected to see a little bit of an increase. We were seeing some decreases. We were seeing discharge numbers that were going downtown, so we were hopeful, downwards. So we were hopeful that that would continue, but unfortunately that has not. So we are concerned. We want to see those hospitalization numbers and the overall admission numbers go down. We know that under some of the modeling that it's projected to continue for some time. The modeling has been very good with regards to a week, 2 weeks in analysis. It's not been so good regarding long term, but the modeling we've seen continues the trend of just keeping it flattened going forward. And the best way to prevent that is to just do smart social distancing. If we're constantly going into public and meeting other people we haven't seen, especially if we're not wearing our masks, then people are just going to continue to get sick. And that's just something we want to avoid. With that, we've basically been doing it for an hour. I want to remind everybody there's a protest scheduled for 1 hour from now in downtown Buffalo surrounding the Rath Building. So if you were planning on coming downtown, I suggest you do not, especially going in the areas of Franklin Street, Pearl Street, Delaware, Church, West Eagle, Niagara Square. We expect there to be a protest, and I just want to recommend to people, if you are planning on coming downtown, which there's really no reason to because there's not much open, but if you did, you're going to get stuck in a protest, and we just suggest you don't do that. Unless we have some important emergency news to talk about, we do not plan on having reports over the weekend, so that this will be the last time that we see you until Monday, that is. When you go out in public, do like we do, put your masks on, make certain you're wearing your masks. I'm going to put my mask on right now because a mask is required in the Rath Building and for all county buildings. So I want people to understand we're taking it seriously, and we hope you do as well. And until then, most importantly, folks, be safe and well. Take care.